So this afternoon for the final session, we really want this to be interactive and really want a lot of your participation and engagement. And so we don't have a lot of preparation here going on. So we're really depending on you. We're not going to hold up any signs for anything. And okay, the first thing this morning, remember when I refused to stop? If I had stopped, I would have been the only one who had been on time, right? And that's what happened to me last time. I was the only compliant one, and everyone else went over time. Just saying. So we really, this session is going to be a little bit different flavor, as I said. I'm from McMaster University, and some of you may know that McMaster is the home of problem-based learning, which means we learn everything in the context of a problem or a case. And so we thought we would kind of bring that to the final session today, and we were thinking about developing a paper problem or an example. And then we thought, you know what, in our own community, we have a really good example of someone who's successfully aging with HIV, and that's Greg Robinson. And he couldn't be here today, but he did a video for us to show today, and that's going to be our case, our problem, on which we're going to form some of our discussions with the panel here today. And really, I hope that people have some interaction, talk with the panel, ask questions. We want to keep this stimulating and keep you awake till the end of the day, because I know it's a long day. Lots to take in. So I'm awesome. We're sharing this with Larry Baxter, and I'll let you introduce.
Thank you, Patty. I'm from Halifax. I'm a person living with HIV as well. And very pleased this afternoon, and a long-time member of Quigger and now Realize, and of Kirk since the beginning. So we're very pleased to have Greg do about a 10 or 12-minute video for us this afternoon. He introduces himself in the video, and he outlines his journey with HIV and how he has coped with it and how rehab has intersected with his life. So we're going to show the video, and it's going to form the basis of our case study this afternoon. And then we have a question for each of the panelists on Greg's case.
Good morning to you all. My apology for not being able to be with you today, and my thanks and graciousness for this honor to speak about my journey in rehabilitation, living with HIV. I'm Greg Robinson. I'm a physician by training. My training is in public health and family practice. I worked as a research physician at the University of Toronto and did predominantly AIDS research near the end of my career. I'm now 61, going on 62 this year, years of age, and never thought I'd get to this point, and quite happily, I enjoy every day. I've been on years and years of treatment now, as I've had my HIV for some 35 plus years. And prior to having HIV, I had no comorbidities whatsoever, and I have not had any other STIs or hepatitis during my HIV infection. I have been an activist and worked for a few years with AIDS Action Now as the co-chair. That position actually, along with being a physician, allowed me to serve as the co-chair for the National AIDS Strategy just after 1996, when we won the renewal of the National AIDS Strategy. At that time, because I was the co-chair, I was invited to a group of rehabilitation professionals, a broad range, multidisciplinary group, to discuss returning to active living, a concept which became necessary to begin discussions about because we realized that the heart therapies that we were going to now be given could allow us to live a long life. So I am an active member, joyful member of Quigger Now Realize, and have actively supported this group since the beginning. I've also actively supported the research that's been going on by a number of rehab professionals and that has been sponsored through the Realize group. I live with a number of health conditions as a result of HIV, some of which are aggravated by aging, some of which came on with aging as well. I have liver cirrhosis, which was found when I bled from varices in my esophagus. My liver disease is a result of D4T DDI, too early nucleoside drugs that were given to us to tide us over until we actually got the right therapies. These, unfortunately, for some of us, caused liver damage, and I have a clot in my liver which starved my liver of oxygen. So I take heparin every day to thin my blood, and so far I have not needed or required any further treatment as far as liver transplant is concerned. They have to occasionally go in and patch things up inside of me so that I don't bleed, but all seems to be well there. I suffer with osteonecrosis of both knees, an uncommon complication in the knees, but not an uncommon complication for people living with HIV, usually in the hips. And as a result of that, I've had osteoarthritis. I have peripheral neuropathy from the D drugs in both hands and feet. I've had an HIV-associated neurocognitive disorder, which actually considerably interfered with my ability to perform work activities, as I was an epidemiologist, and working with numbers became very difficult. There was a stage where I just didn't understand what the numbers were on the page for. A little disappointing, but it was all part of this journey, and I was able to move beyond that. I have diabetes. The pancreas was destroyed by the D drugs as well. I have an advanced human papillomavirus that has infected the anus and causes the occasional need for treatments. I've suffered with depression and with eye disease in this last year that's stable at the present time but is aggravated by age. And I have a restless leg syndrome, which of course causes me great distress in the evenings and at nights when I want to sleep. For all of these conditions, I think it's necessary to talk about what I think was successful in allowing me to move forward. And I'm going to call these my drivers. These were the things that I found over time allowed me to engage in all the rehabilitation that was necessary. And as you can tell from the number of conditions, it's quite extensive. Many others living with HIV will have even more, whether it's related to heart, lungs, and all sorts of other bodily functions that start to fail as a result of drugs, treatments, HIV, aging. My drivers, I think, were the desire to live. And I think, that desire can't be underestimated as a reason for wanting to continue to go on and to achieve. I also had a great desire to maintain active life and be independent. I think that's important for me. As I lose independence, I find that that lack of uncertainty, that lack of certainty and control is very difficult for me. So my third thing is the control of uncertainty. I think by taking action, I've allowed myself to control some of that uncertainty. I've tried to connect with hope as much as possible. And as a result of that hope, sometimes you can actually achieve a dream. And I want to talk to you about what that dream was for me. All of my health conditions have required a form of physical, emotional, mental, spiritual, or social rehabilitation in some form. Physiotherapy, occupational therapy, mindfulness therapies, counseling, brain retraining programs, psychological input, ministers, pastors, fathers, community-based workers who have assisted in various group functions and helped me along as both client and volunteer. I've had input, and I'm going to call this the resources because I think it gives a broad range of the types of resources that I've had to engage in this journey. Doctors, primary, secondary, and tertiary level of care, nurses, rehabilitation nurses, physiotherapists, occupational therapists. I've been in Toronto rehab at the Kilgore site for diabetes and care of my ailing knees. I've had naturopathic input, chiropractic input, acupuncture. I've seen counselors, social workers, and psychiatrists. I've used community-based organizations as much as possible. And more recently, I've availed myself to a trainer within a research program that Kelly O'Brien has gratefully given to this community, and a coach who a swim coach who I now work with regularly and have for the last 3 years. The other part of the resources that I think are important to recognize, because not all of us have these resources and they may be important in future research. I have lots of supports. I have good income. I have lots of time because I am off work. I have family, friends, and a good spouse. I have medical knowledge that allows me to navigate the system quite well. I have an activist orientation, so I actually go for what I want to when I need it, and usually advocate for myself quite well. I have an education. I have access to medical dental plans and other things that allow me to access various rehabilitation resources, such as knee braces, and water belts, and poles, which I'll talk about in a minute. And I also have access to research through both colleagues and being in the Toronto district, which allows us to avail ourselves to more research than is usually possible in smaller communities. Finally, I'd just like to talk a little bit about my specific journey with osteonecrosis. In about the year 2000, just beyond it, I began to have knee pain in the left side. It was excruciating through the night, kept me up all night, and lasted for about 6 weeks, at the end of which it had died. And a few years later, it came on in the right knee as well. This was destruction of the knee from the knee dying as a result of it not having adequate circulation. It left me with a couple of dead bones, tibia on one side and a fibula on the other. Just the heads of these bones are actually destroyed, and so it causes significant osteoarthritis. And as a result, I had limited, very limited knee function. I could not do things like a whip kick or even a straight flutter kick because it hurt so much. At that time, I saw rheumatologists, I saw orthopedic surgeons, and went through the usual series of treatments, including Celebrex and other anti-inflammatories, which I am no longer on. We were able to brace the legs to make sure that they were functionally okay and didn't cause as much pain. So I've used an unloader brace to assist with my rehabilitation. At the time, the physiotherapist I was seeing did some strengthening exercises, but happened to mention some Nordic walking poles that were just new and were being used by the Olympic cross-country skiers in Nordic countries for summer training. Once I got onto the poles, which if you've ever seen them, scooch you along the walkway very quickly, but also lifts you up off your knees and off your back, so that I was able to actually do about 8 kilometers in just a little over an hour. It certainly took a lot of time to work up to that, and after about a couple years, I was up to a full 8 kilometers that I could walk in a day. I also, as I mentioned, went to Toronto Rehab for some rehabilitation at the time too, for strength training around the knees. I engaged in yoga, which was very helpful in both balance and assisted me in stabilizing the knees so that I could actually feel comfortable on them, as well as not have pain. I then got back into the water, which I have enjoyed since I was a young child. I was a speed swimmer, competitive speed swimmer when I was a child, and was on the Windsor Aquatic Club. And so I've always wanted to return to the pool since about 1990, when I last swam events. With the water belt, I was able to do water walking and soon progressed up to water aerobics, and from there, very light recreational swimming. Over the last few years with my coach and with the trainer, we have together been able to work on both a program that strengthens in the dry land exercise component and allows stability to form, as well as I'm back competitive swimming. And the biggest dream that I've ever had, which is now fulfilled, is as a result of this rehabilitation. I now compete in a master's level with others that are 61 to 65 years of age. I will move up at 65 to the next age group and hope that I can set records. But the nice part about this is I've been able to change the metal of my brace to metals such as this, which I truly enjoy, and I'm actually grateful that I've been able to achieve this. Thank you for all your work. It's because of people like you that we are able to actually achieve things like this. I hope that your deliberations around what research will be somewhat helped by this discussion, and that this may give you some insights into where you want to put your rehabilitation focus as it pertains to research. Thank you very much. Have a wonderful day.